What is hydrocephalus? Hydrocephalus is a condition in which an accumulation of cerebrospinal fluid (CSF) occurs within the brain. This typically causes increased pressure inside the skull. Symptoms. The signs and symptoms of hydrocephalus vary somewhat by age of onset. Infants. Common signs and symptoms of hydrocephalus in infants include changes in the head, an unusually large head, a rapid increase in the size of the head, a bulging or tense soft spot fontanelle on the top of the head. Physical signs and symptoms: vomiting, sleepiness, irritability, poor feeding, seizures, eyes fixed downward, sunsetting of the eyes, deficits in muscle tone and strength, poor responsiveness to touch, poor growth. Toddlers and older children. Among toddlers and older children, signs and symptoms may include physical signs and symptoms: headache, blurred or double vision, eyes fixed downward, sunsetting of eyes, abnormal enlargement of a toddler's head, sleepiness or lethargy, nausea or vomiting, unstable balance, poor coordination, poor appetite, seizures, urinary incontinence, behavioral and cognitive changes, irritability, change in personality, decline in school performance, delays or problems with previously acquired skills, such as walking or talking. Young and middle-aged adults. Common signs and symptoms in this age group include headache, lethargy, loss of coordination or balance, loss of bladder control or a frequent urge to urinate, impaired vision, decline in memory, concentration and other thinking skills that may affect job performance. Older adults. Among adults 60 years of age and older, the more common signs and symptoms of hydrocephalus are loss of bladder control or a frequent urge to urinate, memory loss, progressive loss of other thinking or reasoning skills, difficulty walking, often described as a shuffling gait or the feeling of the feet being stuck, poor coordination or balance. When to see a doctor. Seek emergency medical care for infants and toddlers experiencing these signs and symptoms: a high-pitched cry, problems with sucking or feeding unexplained, recurrent vomiting and unwillingness to move the head or lay down, breathing difficulties, seizures. Seek prompt medical attention for other signs or symptoms in any age group. Because more than one condition can result in the problems associated with hydrocephalus, it's important to get a timely diagnosis and appropriate care. The causes of hydrocephalus are poorly understood. It's thought hydrocephalus present at birth may be the result of a brain defect restricting the flow of cerebrospinal fluid (CSF). Hydrocephalus that develops in adults and children is often caused by an illness or injury that affects the brain. Normal pressure hydrocephalus (NPH) that develops in older people may also be the result of an infection, illness or injury, but in many cases it's not clear what causes the condition. Hydrocephalus from birth. Congenital hydrocephalus, when a baby is born with the condition, can be caused by certain health conditions, such as spina bifida. Congenital hydrocephalus can also occur in babies born prematurely, before week 37 of the pregnancy. Some premature babies have bleeding in the brain, which can block the flow of CSF and cause hydrocephalus. Other possible causes of congenital hydrocephalus include X-linked hydrocephalus, caused by a mutation of the X chromosome, rare genetic disorders, such as Dandy-Walker malformation, arachnoid cysts, fluid-filled sacs located between the brain or spinal cord and the arachnoid membrane. In many cases of congenital hydrocephalus, the cause is unknown. Hydrocephalus that develops in children and adults. Hydrocephalus that develops in adults or children, acquired hydrocephalus, is usually the result of an injury or illness. Possible causes of acquired hydrocephalus include bleeding inside the brain, for example, if blood leaks over the surface of the brain, subarachnoid hemorrhage, blood clots in the brain, venous thrombosis, meningitis, an infection of the membranes surrounding the brain and spinal cord, brain tumors, head injury, stroke. Some people are born with narrowed passageways in their brain that restrict the flow of cerebrospinal fluid, but do not cause any symptoms until years later. Hydrocephalus in older people. Normal pressure hydrocephalus (NPH), hydrocephalus that develops in older people. Normal pressure hydrocephalus, or NPH, can occur after a brain injury, bleeding in the brain or an infection. However, in most cases, there's no clear reason. It may be that NPH is linked to other underlying health conditions that affect the normal flow of blood, for example, diabetes, heart disease, or having a high level of cholesterol in the blood. Diagnosing hydrocephalus. The most common initial diagnostic test to determine hydrocephalus at any age is an image of the brain using CT or MRI to identify if the ventricles or spaces within the brain are enlarged. More tests are often performed in adults in order to diagnose the condition. The decision to order a particular test may depend on the specific clinical situation, as well as the preference and experience of the medical team. Not all of the tests described here are required in order to make a diagnosis. Clinical exams to evaluate symptoms consist of an interview and/or physical neurological examination. Brain images to detect enlarged ventricles commonly include magnetic resonance imaging (MRI) and computerized tomography (CT). CSF tests to predict shunt responsiveness and/or determine shunt pressure include lumbar puncture, external lumbar drainage, measurement of CSF outflow resistance, intracranial pressure (ICP), monitoring and isotopic cysternography. Treatments for congenital and acquired hydrocephalus. Both types of hydrocephalus require urgent treatment to reduce the pressure on the brain, otherwise, there is a serious risk of damage to the brainstem, which regulates functions such as our breathing and heartbeat. A shunt is the surgical insertion of a drainage system. A catheter, a thin tube with a valve, is placed in the brain to drain away excess fluid from the brain into another part of the body, such as the abdomen, the chest cavity, or a chamber of the heart. Usually, this is all that is needed, and no further treatment is required. Patients with hydrocephalus will usually need to have a shunt system in place for the rest of their lives. If the shunt is placed in a child, additional surgeries may be needed to insert longer tubing as they grow. Ventriculostomy, the surgeon makes a hole in the bottom of a ventricle so that the excess fluid flows towards the base of the brain. Normal absorption occurs at the base of the brain. This procedure is sometimes performed when the flow of fluids between ventricles is obstructed. Treatment for normal pressure hydrocephalus shunts may also be used for normal pressure hydrocephalus. However, shunts may not be suitable for some patients. Other procedures may be carried out to check suitability. Lumbar puncture, some of the cerebrospinal fluid is removed from the base of the spine. If this improves the patient's gait or mental abilities, fitting a shunt will probably help. Lumbar infusion test, a needle is inserted through the skin of the lower back into the spine. Measurements are taken of CSF pressure as fluid is injected into the spine. Patients usually benefit from having a shunt fitted if their CSF pressure is over a certain limit. Hydrocephalus, fluid on the brain, can cause some complications, or complications may develop as a result of the surgery used to treat it. Shunt malfunction. A shunt is a delicate piece of equipment that's prone to malfunction, usually through blockage or infection. It's estimated that up to 4 out of 10 shunts will malfunction in the first year after surgery. Sometimes a scan carried out after the operation shows that the shunt isn't in the best position, and that further surgery may be needed to reposition it. If a baby or child has a shunt fitted, the shunt may become too small as your child grows, and it will need to be replaced. As most people need to have a shunt for the rest of their life, more than one replacement may be needed. It's estimated that most children with hydrocephalus may have an average of 2 procedures for shunt problems before they're 10 years old. Occasionally, when shunt tubes are positioned, bleeding can occur. This can result in nerve problems, such as weakness down one side. There's also a small risk of seizures, fits, following any surgery on the brain. In younger children, particularly babies, cerebrospinal fluid (CSF) can run alongside the shunt rather than down it, and it can leak through the skin wound. If this occurs, further stitches will be needed to stop the leak. Shunt blockage. A shunt blockage can be very serious because it can lead to an excess buildup of fluid on the brain, which can cause brain damage. Headaches, feeling sick, being sick, confusion, drowsiness or coma. In babies, you may notice their head growing larger, or they may have a bulging or tense fontanelle, the soft spot on the top of their head. Contact your care team immediately if you or your child have these symptoms. Emergency surgery will be required to replace the malfunctioning shunt. Shunt infection. Shunt infection is also a relatively common complication. The risk of infection can be around 3 to 15% and is more likely to occur during the first few months after surgery. The symptoms of a shunt infection may include redness and tenderness along the line of the shunt, a high temperature, fever of 38 C, 100.4 F, or over headache, being sick, neck stiffness, tummy pain. If the shunt drains into your tummy, irritability or drowsiness. In babies, contact your care team immediately if you or your child has these symptoms. You may need to have a course of antibiotics to treat the infection and, in some cases, surgery may be required to replace the shunt. Complications of endoscopic third ventriculostomy (ETV). An endoscopic third ventriculostomy (ETV) is a surgical procedure where a small hole is made in the floor of your brain. Complications can occur after this type of surgery, such as, the hole can close, your brain may not be able to absorb the cerebrospinal fluid that's now draining through it, you may develop an infection, although this is less likely than after shunt surgery. You may have bleeding inside your brain, this is usually minor. If there's a problem with the hole, it may be possible to repeat the procedure, or you may need to have a shunt fitted. Other risks of ETV include nerve problems, such as weakness down one side of the body, double vision, or hormone imbalances. Most nerve problems will get better, but there's a small risk of permanent problems. There's also a small risk of epilepsy, and a very small risk of an injury to one of the blood vessels in the brain, which may be fatal. Long-term complications of congenital hydrocephalus. Many babies born with hydrocephalus, congenital hydrocephalus, have permanent brain damage. This can cause a number of long-term complications, such as, learning disabilities, impaired speech, memory problems, short attention span, problems with organizational skills, vision problems, such as a squint, and visual impairment, problems with physical coordination, epilepsy. Thank you for watching. Please don't forget to like and subscribe to my channel, and please click on the bell so you'll be updated on my next video. Thank you. WeCare for you PH. Your health comes first.